Hi, I'm State Senator Joe Bolkcom, and I'm joined today by my colleague, State Senator Zach Wahls. And we want to give you an update on a tour we took yesterday, May 14th, of the State Hygienic Laboratory in Coralville. You might know the State Hygienic Laboratory is the state's public health lab. It was started in 1904, and they're responsible for testing all sorts of different things, including water, air. They do maternal and newborn testing. They do all our infectious disease control work, STDs, HIV testing, and have just a fantastic track record of doing some really good work. Over the last 3 weeks, as the governor signed a contract with a group called Test Iowa out of Utah, the Hygienic Lab has been on the forefront of trying to make the equipment that they provided essentially work. And so we were able to visit the lab yesterday and had a tour led by Dr. Pentella, the director of the lab, and we learned quite a lot, didn't we, Senator Wahls?
Yeah, absolutely. One of the things that really stood out to me, and folks at home might be wondering, well, why is the State Hygienic Lab so important? They've actually done about 50% of all of the COVID-19 tests in the state of Iowa since the outbreak began, and we first detected cases here back in March. They're also the home of the new Test Iowa equipment. So you've probably seen this in the news a couple of weeks ago. The governor signed this $26 million contract with a Utah-based company to stand up some more testing capacity here in Iowa. This involved getting several new machines that were then placed in the State Hygienics Lab to be operated by SHL faculty members and the folks who work at that lab. And so it's something that's really important to the health of every Iowan, is this ability to conduct these tests. And it's the folks at the State Hygienic Lab who are really making that possible. And Joe, I know that you'd visited the facility before, but it was the first time that I had had the chance to visit. And I was really struck by just the dedication and the passion that these folks really bring to their work.
We have a really, really strong group there. They've been working over the last 3 weeks. The Test Iowa equipment has been there, and it's been in the news that they've been having trouble so-called calibrating or validating the tests that are being run through it. And just this week, after many, many hours of work, the lab was able to certify for the first time that the results that are being provided through this new equipment are actually accurate to a degree that they're comfortable as scientists that do a lot of testing. They are working hard. They've got a plan to continue to test. The capacity of Test Iowa is like 3,000 tests a day. I think one of the things that's been a bit of a disappointment about Test Iowa at this point, something that we've learned, is that the State Hygienic Lab essentially wasn't consulted at all prior to this equipment arriving in their facility, and they are now responsible for making that equipment work. And Senator Wahls, as you noted, it's a $26 million contract, but it doesn't take into account the cost of our staff at the Hygienic Lab to run these 3,000 tests a day. And it's disappointing that they weren't consulted about this important project prior to it arriving at the lab.
That's right. And to make the 3,000 tests per day an option, they have to have, literally dozens of people working literally around the clock 7 days a week in order to hit that 3,000 tests per day number. And then that'll be in addition to the thousands of tests per day that the rest of their staff is doing on the other machines that SHL has, and using test kits that are being provided by other sources other than Test Iowa. One of the things that really impressed me was the dedication to the science, as you mentioned, Joe. These are folks who really don't bring a lot of politics to this at all. They're folks who are really focused on their mission. And when we were there, we got to see their mission, vision, value statements, professionalism, scientific rigor, things that they really, really value. I thought it was really good news to hear that the machines that they're working with, now that they've finally been able to validate them, do have a high level of what's called sensitivity, or basically their ability to make sure that they're actually catching the people who are positive. I think that was 95% was there on the sensitivity, and then the specificity. So this is making sure that we're not giving people a false negative. was 99.7. And so those are pretty good numbers, much better than what we were seeing originally from some of the Abbott machines, which was the first round of machines that were in the news, not just in Iowa, but across the country, these so-called rapid test kit machines that had a much, much lower sensitivity rating. And we actually, when we were at the lab, we saw these literal boxes of the Abbott machines and some of the test kits that were literally stacking up because now that they're known not to have that level of sensitivity that you need for them to really be reliable. We know that people are trying to get tests from another source, including from Test Iowa. But one of the big challenges that I think we're still running into is that even though 3,000 tests per day sounds like a lot, if we only stayed at 3,000 tests per day going forward into the future, it would take literally years for every single Iowan to get tested, right? And so I'm hearing in my inbox from constituents who either they want to test or members of their family want to test. And because the restrictions currently on the Test Iowa guidelines are so tight, they actually aren't able to get a test even if they want one. And that's a big concern that I have.
Well, as things begin to open up, and the governor's made a new proclamation that's going to allow restaurants and a whole host of facilities to begin operation, it's going to be really important in who doesn't want to open things up. You know, I think everybody is ready for this economy to get going again, but we need to do it safely. And there are a number of things that we need far more transparency from the governor's office on. And certainly one is testing and the need to have more testing. There's a Harvard study that suggests Iowa needs to get to 10,000, just over 10,000 tests a day. We're somewhere between 3,000 and 4,000 tests a day now. We still have very, very tight controls over the criteria about who actually can get tested, and those need to be relaxed. But we need also to have a better sense of what the plan is the governor has on expanded testing. Great, Test Iowa is finally working. That's terrific. What's the next horizon for adding more testing? And then Senator Wahls, as we've talked before, the whole issue of contact tracing.
Yeah, that's absolutely right. And I want to give a big shout out to the folks, especially here in Eastern Iowa where we live. We have really done, I think, a pretty incredible job. Folks have really practiced very rigorous social distancing. People have been staying home. Employers, not all employers, but many employers have done a very good job supporting their staff and working from home. And so we need to make sure that we're thanking the folks. We ask people to stay home, to social distance, stay home if you could. And people really stepped up to the plate. But we can't live like this forever. It's simply not who we are as people to stay cooped up indoors all day. We've got to be able to reopen the economy to get back into public. But to your point, Senator Bolkcom, we got to do it in a way that's safe and that's responsible, and that will wind up creating a second wave that's going to overwhelm our healthcare system. So what that means is we absolutely have to continue to expand our ability to do testing, because testing is going to be a really critical part of what's called contact tracing. So contact tracing is what you're able to do when you have enough testing and you've got enough public health staff to basically, when somebody does test positive, to go out and talk to all of the people who they've interacted with, whether that was they went to a hardware store and they were talking to the clerk there, or they've got family members at home, and who did the family members see when they went out and about. And that's the way that you're able to really get out into the public and actually try to get ahead of the curve. So we've been talking about flattening the curve, and it's about the rate of new infections. And we've done a pretty good job of bringing the curve down. But to keep the curve down, we now have to get ahead of the curve. And the only way that you can do that is by having really expansive testing, followed up with really extensive contact tracing. And so that's got to be the plan going forward. I know that we're going to see some of that here at the local level. We're here in Johnson County, but we're going to have to see this statewide. We're going to need support from the state government, and we're going to need support from the federal government. And I think Iowans have done a really incredible job doing our part to help try and flatten the curve for these last 2 months. The big concern that I have is that over these last 2 months, now, what's the plan from the federal government to support states? As states try to make our own plans, what are we going to do to really ramp up our contact tracing? That's a big question mark for me.
Well, and I would add, as part of our efforts around contact tracing, does the State Department of Public Health have a plan? Is it in writing? And why can't we see a copy of it? I've made a request for their plan around this. It relies on local departments of public health that choose to do it, relies on the National Guard. We've heard the talking points at the governor's press conferences, but unless it's written down and shared with people, it's nothing more than talking points. It's not a plan. I think Iowans deserve to see it. And I think also in that regard, the state received more than $1 billion in CARES Act funding to support our public health effort around this. We need to see some of that money going to our local public health agencies who are on the front line of this pandemic. But kind of moving to wrap it up here, Senator Wahls, one of the things I think that's going to give Iowans confidence about the state's response is far more transparency from the governor's office about her plans on testing, on contact tracing, on PPE. You know, there's a lot of issues, and there's been a lot of concern about just the lack of transparency, and that's probably the word, about what is going on. And I think Iowans can handle the truth. We need to have the details. It will give people confidence. Transparency is what will open up this economy again, as well as these other things we've discussed. And I hope that as we go back to the legislature here in June, we'll be in a position to get some answers to some of these questions Iowans have.
Yeah, Senator Bolkcom, I think you're exactly right. It's not just a question of restoring health. It's also a question of restoring confidence, right? People aren't going to go out into public. They're not going to go out to go to a restaurant or to go shopping if they don't feel safe when they're out in public. And so that's going to mean making sure that we've got really strong plans in place to restore public confidence and helping people feel comfortable when they're out in public. It's not a secret that Iowa is an older state. We're one of the states in the country that's aging faster than average. And so we've got a lot of Iowans who are in that elevated risk population. And so we got to really make sure that we've got good cooperation between state and local governments, as well as employers and the public, to make sure that we're engaging in the necessary steps, wearing personal protective equipment. I've got a couple of masks that I wear when I'm out in public, and we're starting to hear about some emerging research around wearing face shields, which are shown to be very, very effective in terms of slowing and stopping the transmission of COVID, that are going to have to be a part of the conversation as the economy does reopen and we start to really work and take steps to restore public confidence and make sure that we're able to start moving into this kind of new normal that we're going to be in for the next probably at least several months and maybe up to a year or two. I think one of the things that's really important for people to understand is that as we kind of are moving here into the summer, this is not the beginning of the end. And in a lot of ways, this is really just the end of the beginning. We've been able to successfully work to try and slow and contain this initial outbreak of COVID-19, but this is very far from over. And it's going to be a long time still until we kind of go back to how life was in February of 2020.
Well, let me close out by once again thanking you, Senator Wahls, for joining this conversation, but really thanking Dr. Pentella and his team at the State Hygienic Lab for taking some time with us yesterday to get a thorough tour of the lab. We were impressed with what we saw. They've got a lot of work ahead, and we know they're capable and ready to take it on. I also like to thank all our faculty at the College of Public Health that have been involved at the University of Iowa in helping the Department of Public Health with some of the work they have on modeling and trying to predict where we're headed with this pandemic. So thank you for tuning in, listening to this conversation. Please let us know if you have any questions, and stay safe.